How is everyone doing? Welcome to our first webinar of the season, of the year, actually. I hope all of your New Year's are off to a good start. And we are here with our favorite partner, Sysi. And we have two people here joining us from Sysi. We're excited to tell you about them. And as we're coming in, feel free to participate, put in where you're coming from, where you're signing in from. We'd love to know who you are. And then I will kick off our webinar and get started. At the end, we will have time for Q&A. So if you have questions, feel free to put them in the chat as we go along. And so we're going to get started just now. So welcome, everyone. I am Dr. Lynae Brayboy. I'm from Ovom Care. And we are here to talk about emotional well-being in fertility care. So I'm going to get started in just a second. And if you hear a little dog in the background, it's my dog. He's my emotional support dog. Okay, so disclaimer, this is not medical advice. This is not meant to replace therapy or medical care. So what is Ovum? Ovum is a hybrid IVF clinic, and we provide in-person and online care, and we leverage AI tools to help improve the patient experience, success rates, and also make it more accessible to have IVF or in vitro fertilization. So we are opening our very first Ovum clinic in Lisbon. We previously had a partner clinic in London, but our very first clinic is opening in Lisbon with our medical director who's on this call, Dr. Renato Martins, if you want to wave your hand, and you'll meet him in just a second. And the reason we have chosen Lisbon is because of our wonderful medical team that's there. Dr. Renato Martins is, I said, the medical director. Dr. Joaquim Nunes is the clinic director. Also our senior fertility nurse, Vanda Costa, and our VP of clinic development and embryologist, Ahmed Ahmed. So we're at your service. If you ever like to have a medical consultation with any one of us, we would be happy to see you. So why Portugal? It's an ideal destination. It's easy to get to. It's beautiful. The food is amazing. And the weather is usually nice. Although today I hear it's raining and a bit cold, but usually it's beautiful. So, and our clinic is right in a natural paradise. So it's about a 10-minute walk from a beautiful beach. Right across from our clinic are two wonderful hotels, one resort, one Sheraton, not too far away. We have negotiated rates with them. And again, it's easy to get to Lisbon. Lisbon is a really central hub for Europe, and you can fly to almost every continent very easily with no problem. So now I'd love to introduce Sysi, our partner here on our call with us. And I'm going to turn it over to my co-host, Blanca, if you would go ahead and tell us about Sysi.
Great, thank you. Hi, everyone. I'm so thrilled to be here. I'm Blanca. I'm the founder of Sysi. And Sysi is essentially an online mental health platform that provides very high quality online therapy services. We currently have 3 different services. We have individual therapy, couples therapy, and fertility counseling. And Sysi was built on 3 pillars. The first being high quality care. So we have a team of expert psychologists and psychotherapists, personalized service. So we offer complimentary consultations to personally handpick the therapist for each client. And then we also follow an integrative approach to care. So all of the therapists are trained in multiple modalities. So we basically avoid a one-size-fits-all and create a therapy for each individual.
Blanca, thank you so much. So now I'd love to introduce to you our panelists tonight. So as I said, my name is Dr. Lynae Brayboy. I'm the co-founder and chief medical officer at Ovom Care. I'm happy to have my colleague, the medical director of Portugal, Dr. Renato Martins. If you'd like to go ahead and introduce yourself, Dr. Renato.
Hello, everyone, and good afternoon, evening, depends where you're calling us. My name is Renato Silva Martins, and I'm the medical director for Ovom Care Portugal. My training is in obs and gynae and in reproductive medicine for over more than a decade. And we are here to help you and guide you on your journey.
Thank you, Dr. Renato. Blanca, back over to you, please.
Hi, everyone. As I've already introduced myself, I'm Blanca. I'm the founder of Sysi, but I'm also a psychologist. And I have Miriam here, who is on my team. Miriam, would you like to introduce yourself?
Yes, I'm Miriam Christie. I'm an integrative psychotherapist. I specialize in pre and postnatal psychotherapy with an extra specialism in fertility counseling, which I do in partnership with Sysi.
Thank you so much, everyone. So we're going to kick it off with some questions, but if you have burning questions in the audience, please feel free to put them in the chat. So Dr. Renato, our first question that I want to talk to you about is, from your perspective, how does mental health influence both the process and outcomes of fertility treatment?
Well, infertility by itself, it's something that people struggle with because uh, uh, coming from the clinical point of view, it's something that you are not expecting because it's something that's supposed to be natural. It's something that most people are unaware of, that they might struggle with conception. And it also, in the majority of cases, involves not one, but two or even more people. So you really, as coming from the clinical side of it, it's very hard even for us as as medical professionals to deal with it, because sometimes we are not sure how to approach and how to help people, mainly because even the patients themselves sometimes struggle expressing what they are actually feeling, and this sense of inability, something that they have for sure or certain of being able. Sometimes they didn't even consider parenthood as a main focus of their whole life, but also, and this is coming from a Latin country, there's so much pressure in terms of social surroundings sometimes, and people don't come from they don't come from a bad place. They are just trying to help, but some questions and the queries that they often do, and the pressure that they put on the person, and mostly women, but also in the couple, why, when is a baby coming, things like that can be very, very harmful, and it's very difficult for us to help them.
Yes, thank you so much for that, Dr. Renato. In my training as a fertility specialist, I spent 12 weeks embedded in a support group of fertility patients, and I think it was one of the most valuable things in my training, because it allowed me to understand things that you don't understand in the context of a 45-minute visit. It allowed me to hear things that normally people might not say in front of a clinician. And I think that's why at Ovom Care, we really want to provide something different, because traditionally there's not that outlet, there's not that access. So that's why we've partnered with Sysi. And I'd love to ask Blanca a question. What are some of the most common mental health challenges that in general people face during their fertility journey?
Mm-hmm. Well, as you know, the fertility journey can be an emotional roller coaster with so many highs and lows, and that can really take a toll on your mental health. In terms of the most common challenges that we see, the first would be anxiety and stress. So there's a lot of uncertainty, there's a lot of fear, there's a lot of pressure, as Renato said, and that can be very overwhelming. Sadness and grief, depression and grief, right? So feelings of sadness, of hopelessness, of loss, those things also come up a lot. Guilt and shame, due to societal pressures and expectations about parenthood and what it should look like and how it should go. And then lastly, something that we also see a lot is isolation and loneliness. Which is often due to feelings of being misunderstood. They feel misunderstood, or they fear being misunderstood, but also a fear of being judged, which is linked to a lot of the stigma that we also see.
Thank you so much for sharing. And how do those health issues present in the course of care? What have you seen, Renato? in your experience?
Generically, we can actually see when it's the first consultation, when the couple has already started the journey or when they are naive to it. Because when it's the first time, they just think, oh, we're not trying to conceive. Someone makes a referral, they just come popping for the visit, and they come very bubbly, very high hopes, very excited, very wanting to do everything at the same time, quick, very fast. But they are on a high because they think, or there's this perception that, okay, now we've got a medical consultation with someone from the reproductive field, and this is going to be fairly easy. So it's just a consultation, an IVF, and it's done. And the expectations are very high. They set the expectation very high. And they just think, because of everything that is still around when you actually see information about IVF through social media, through films, movies, whatever, they make it seem like it's very painful, the medication, which they are not. But then there's not that correspondence to the mental toll that infertility actually has. Because there's this perception that, okay, we have a problem, now let's try to solve it. On the right place, with the right people, they will sort it out for us very quickly. And in contrast, sometimes we actually see people that have been on a very long journey. They just come very deflated. It's so difficult for even to maintain a conversation, trying to give a little bit of hope where the majority of these couples already don't have. They are completely depleted of any sort. They also tend to be very defensive. So anytime that you try to ask something or you try to help them any sort of way, they are in a very defensive position and they do not trust what you're saying. So it's a struggle, and we do have to keep on pushing until people actually start to believe in us and accept whatever we have to offer them, and then we can move a little bit. And I think that's the main purpose of having someone from the psychology department helping us. In my previous job, I actually had this first consultation, this first approach of the couple, I was in one room and my psychology was on the next one, and the couple would on the same day see both of us. So it was very helpful because they would talk to me and then they would talk to the psychology, and if they had questions they would come back to me and we would juggle a little bit, and I think they benefit a lot from that.
Absolutely. Absolutely. And in the modern fertility clinic, maybe you don't have time to stay in an office. And so the benefit of working with Ovom Care is that you work with our partners like Sysi, who can offer you those same counseling visits in the privacy of your home, from your sofa, so that you can have them when you want, not on the office hours time, but on your time. So I'd love to hear a little bit from Miriam. You are a fertility specialist, and Renato and Blanca touched on the topic of grief. We don't really think about fertility care as something that causes grief. Can you tell us a bit more about the role that grief plays in fertility?
Yes, I was nodding along there. I think Renato really characterized a lot of the fertility journey that I went on from start to finish, from being starry-eyed to feeling quite dejected about the whole thing, really having to hold on to some hope. And I think I hadn't thought about it before, but I think I wanted to start off with that feeling that maybe of grief that we don't sometimes give a lot of attention to, which is the uncertainty that you're talking about. I think often in our lives, if there's a problem, we fix it. And we get quite used to that being the way our life goes. We might have gone to university and worked hard and got a degree and got a job, and problems have happened in our lives and we've been able to work them out. And then this might be the first time in people's lives that there is an uncertainty, and the loss of control that creates is a kind of grief. There's a, my life is not going to look how I imagined it was going to look like, or my fertility journey isn't going to look as I thought it was, and it doesn't feel as in control anymore. And that can be really destabilizing. And I think therapy really is a space where you can start to reconcile with that and reframe it for yourself. And then, of course, there are the griefs that we're maybe a bit more familiar with, which are the transfers that are unsuccessful and miscarriages further down the line. And I think what can often happen for couples or individuals, if they are not having therapy, is that there can be that these opportunities to grieve can pass us by until they just become this feeling of overall trauma and dejection. And I don't think we're very good in society actually at acknowledging that these are losses. And so sometimes it feels like a big loss to the person, and they're hearing, oh, well, better luck next time. And actually, no, they've lost a baby, you know, to them, they've lost this potential pregnancy, and it's a big thing. And so actually to be able to honor that loss then creates the space to be able to then carry on and hope and be positive about the next steps. But I don't really think you can have that real sense of positivity before you've allowed yourself to grieve. And I think that's something that therapy can be very, very valuable for on this journey. Was there anything more around that? Yeah, I think just touching upon, again, that sense of the uncertainty of it all. I think perhaps there is a grief in having to reconcile that things aren't the way that you hoped. And once you're able to do that, there can be a real positivity in being able to shape and decide how you go forward as a individual or as a couple. But actually, I think fertility in this space, but also I see it in the wider in society, where we're not very good at holding space for grief. We want to rush past it, but it will come up and it will get us if we don't give it a bit of space to be able to talk about it.
I love how you said that. It will run up and it will get us if we don't really address it and grieve and give ourselves time to grieve. I want to move on to like guilt and shame, right? There's a lot of stigma that we don't talk about when it comes to the fertility journey. And Dr. Renato mentioned it, especially coming from a Latin country, or if you're from a brown or Black place, you know, your aunties might be asking, your neighbors might be asking, and there's a lot of pressure. So Miriam, can you walk us through how they arise, how these feelings of guilt and shame come up?
I mean, a lot of guilt and shame can show up on this journey, and I'll keep it quite focused on some of the more common things, but actually it can be so subjective because our childhoods and our experiences to this point can often be littered with guilt and shame that we haven't realized and we've internalized, and then this journey can be very triggering. What I think Renato touched upon, which I see a lot in the therapy room, is an anger with their bodies, an anger with themselves that they can't do something which their body is supposed to be able to do. And I think certainly in the UK, sometimes there is a misservice done in education growing up that if you have sex once, you'll get pregnant. And so there is quite a contrast then to what then they're experiencing, and actually the shame that then is internalized around that, why can't I do what I'm supposed to be able to do, can be really intense. And that can be for the man and the woman, you know, but actually men carry a lot of shame if they aren't able to, if they don't have a high sperm count, or for whatever reason it's their bodies that can't do it. And often that goes under the radar and unacknowledged. And there can also be a shame in being the one who isn't, if the the woman is going through fertility and the partner is trying to support, there can be a lot of guilt that then they feel like they're not doing an awful lot. They have no role. They don't know how to support. Their partner is the one who is experiencing all of the stress. And that can kind of cause divisions, that can cause resentment on different sides there if it's not addressed and acknowledged.
Yeah. And how would you address it in therapy in a hypothetical situation? How do you help people to sort of, get above and around the guilt and the shame that's sort of in us?
Yes.
How we're socialized.
I think this is where therapy is invaluable, in that it's this confidential, safe space where you get to talk about things that maybe you haven't actually spoke about before. And there's that beautiful quote, I think it's Anne Boskamp, which says, "Shame dies when stories are told in safe spaces." And I always think about that when related to this, that by being able to bring your vulnerability into the therapy room and have it held and accepted, somehow the shame is able to melt away and we're able to look at what's left, and there can be sadness, there can be anger, there are all sorts of things. And sometimes there is a challenging of that old belief. Oh, I thought that this was my failing, and actually maybe this isn't a failing, maybe this is a challenge, maybe there are positive things, that next steps that I can take. It suddenly makes it into an empowering thing. It can be incredibly freeing to be able to shake off some of that shame and feel that you're unconditionally cared for and held in that space, and this is just yours to be able to really to unpick what's underneath those difficult feelings that you're having around guilt and shame, which does show up, as you said, Lynae, in various different ways in the therapy room.
Absolutely. And, Dr. Renato mentioned this, but people often feel very isolated. Blanca, you mentioned this too. Blanca, could you maybe talk about the loneliness that happens? I mean, we don't stand around the water cooler in the office and talk about infertility. It's still stigmatized. It's still not treated with the same loving care that people who have a broken leg would maybe have. So how is it that this unseen pain, how does it make someone even more lonely and more isolated?
Mm-hmm. That's a really good question. I think loneliness can come about for many, many reasons, but I think a main one is that people often, as you said, suffer in silence. There's a fear of being misunderstood. There's a fear of being judged, because of all the stigma that still unfortunately exists. And I think that fear kind of can cause you to retract, right? So it can cause you to say, you know what, I'm isolating myself, or I'm going to withdraw myself from certain social situations. And I think what we see is that when that happens, it takes a toll on the relationship. So strained relationships with loved ones, and that can then, deepen the feeling of loneliness. So it almost becomes this cycle that can feel very overwhelming and very difficult to get out of.
And how can therapy help that? How does therapy really bring people out of that isolation?
Well, the first thing I would say is to work on your relationship with yourself. The way that you feel within yourself impacts how you feel in the world and how you relate to others. And I can't emphasize enough the importance of how you speak to yourself. It's so important, like throughout this journey, to speak to yourself with kindness, with compassion, to be patient with yourself, to allow yourself to feel all the different emotions that come up without judgment, but to also prioritize self-care, right? To be able to essentially do more of the things that are good for you, and do less of the things that you're actively doing that don't make you feel good. So I would say that that's the most important thing, is working on that relationship with yourself. I would also say for people who are feeling lonely, to also, I think, and this comes up a lot in therapy, that to encourage them to speak about how they're feeling, not only in the therapy room, but also with people that they trust. Even if someone doesn't exactly understand 100% what it is that you're feeling, or if they can't necessarily relate to your experience, just letting yourself be seen, expressing how you feel, it can make such a difference. And there's actually a lot of people that are struggling with fertility. And so I think that, you never know, like maybe you speak to someone that's actually going through the same thing or has a loved one who has, and that can feel really great. So I'd say like those are like the main things that come up with loneliness. But I think another one would be, beyond mental health care, joining a support group can also be a really great idea. So it's a great way of being able to connect with other people who are maybe going through a similar situation, and that community can also be really powerful.
Amazing. And, we go through this journey often not alone. And you can be in relationship with someone else, with a partner, with a co-parent, and your family in general. How are relationships impacted when you're going through this journey? If you wouldn't mind telling us in your experience, Blanca.
Well, I think when there's a lot of anxiety and stress, there can be a lot of conflict, and there can also be a lot of communication issues. It brings up so many different emotions, and that naturally impacts the relationship dynamic. Also, often people process things differently and also have different coping strategies. And what we see is that when there's a mismatch between the two, it can feel very isolating, but it can also make you feel very disconnected with your partner. I think also the pressure of the success of the fertility treatment can also really take a toll on physical intimacy. And then finally, I would say the guilt and the shame that Miriam spoke about. I think that can also come up a lot in the relationship. Whether it's that you're blaming yourself or that you're blaming the other. It can lead to feelings of inadequacy and resentment, which can also really harm the relationship.
Absolutely. Thank you so much for saying that. And I think, there's a lot of, social pressure in general, right? Not just between a partner or a co-parent, but there's a lot of social pressure. And there are boundaries sometimes that are crossed. I think Renato touched on this as well. So how can patients effectively set boundaries and navigate that stigma? So maybe I'll ask you, Blanca, to talk about how to set boundaries, and then everyone kind of talk about their experience navigating stigma and societal pressure.
So I think when it comes to boundaries, something that's important to keep in mind is the boundaries are there to protect yourself, not to protect others. Boundaries aren't mean, they're not selfish, they're not walls, they're not rejection, they're an act of self-care and self-love. And so, within, more specifically, the best way to put boundaries, number one, I'd say to really think carefully, what is it I want to say and who do I want to share that with? My suggestion would be to think about it beforehand so that you don't find yourself having to make that decision in the heat of the moment, which can be really difficult. So really take some time to think about that. It's okay to not share everything. It's actually a good thing to keep some things to yourself. And so to really allow yourself that space to think about that, to also communicate the boundaries clearly and to not be afraid to do so. You can use firm and assertive language that's also very respectful, but often people kind of expect other people to put the boundaries that they want to set for them, and things can get really lost in communication. So just say what it is that you need, and equally express what you need to the people that you care about. Where are the people, your loved ones? So if what you need is a space to voice how you feel, say that. If what you need is them to respect your silence, say that. If you don't want unsolicited advice, then also say that. It's your responsibility to voice what you need, and it's their responsibility to respect that.
I love it. And around the room, the virtual room, any other information or advice for navigating the societal and the pressure, the stigma that comes with fertility journeys?
Yes, actually, funnily enough, Blanca's advice reminded me of a case study, and I'll skip their details, but I had a client a while ago really using that advice, actually, Blanca, and she was going to a family dinner and it just felt really overwhelming. And actually, she was able to ask in advance that nobody asked her any questions. She felt she just wanted to see people but couldn't bear having to keep telling the story of where they were at and what was happening and, as you said, being given advice. And so very bravely she said, oh, I am looking forward to seeing you. I don't really want to talk about this tonight. And she also knew that there would be just a certain amount of time she would be able to be with other people who had children or were also pregnant, and just acknowledging that for herself. She actually booked a Sainsbury's delivery to come at a certain time, so she had to say, I've got to leave now because I'm going home for my shopping delivery and whatever it was. And it wasn't a lie, it was true, but it gave her that sort of block of time, the boundary of time, where she knew she was going to be able to be with people and feel okay, but then be able to also care for herself and know that she was going to have to come back and have a little bit of downtime where she was, free of having to socialize. And I really respected that. I think it's a really good example of what you were talking about, Blanca. I think it extends to social media as well, actually. And I know it's surround sound these days. It can be really hard. And I liken it a little bit to when you're single and everybody in the whole world looks like they're in couples walking around holding hands. But it feels like all of your WhatsApp messages are about your friends having babies, and the algorithms know us really well now, don't they? So you go on Instagram and somebody will be telling you about something to do with fertility, and it can just feel like too much. And we can't necessarily get away from that nowadays, but I would recommend that people curate it as much as possible. Maybe have some time away from social media so that they're not always getting blindsided by difficult emotions that they aren't ready to deal with at certain points of the day. I think it's a really difficult thing these days to have to manage, because we live in a world where we're always being bombarded by information, aren't we?
That's so true. That's so true. Dr. Renato, any other closing thoughts? And then we're going to open it up for Q&A. So if you have a question, feel free to put it in the chat. I see there's some questions already.
Yeah. Well, sometimes I think it comes with the Y chromosome. Sometimes I'm a little bit brutal about it, but whenever I see someone struggling with this whole overwhelming situation, I just tell them one thing, which is, for instance, let's think that you are not struggling with fertility. Just go back to that. Think that you have a house with 5, 6, 7, 8 kids. You don't struggle with infertility. Would you go around the room in dinner talking about your intimacy, about your sexual intercourse, how often you do it? So you don't. That's not socially acceptable. But with people that you trust, with your best friend, perhaps you will try to go a little bit further and tell them, well, I'm actually having this sort of problem. So whenever I say it like this, people take away the fertility issue, and they think, well, yeah, if people that don't struggle with infertility, if they don't talk in a gathering, in a social dinner about their sexual lives, unless they want to, why should I have to do it? So it's what Miriam was telling, and Blanca. So you need to set your boundaries. You need to say, people, enough is enough, because you are already in a very fragile state of mind. And sometimes people are just trying to help. Sometimes they are not trying to be mean to you, but they are actually harming you. And you need to set those boundaries. You need to say, well, this is enough. I really don't want to talk about this, but allow yourself as well to have someone to vent, so that you don't have to go alone on this pathway. So just choose someone that you can actually confide in, and then just vent out as much as you can.
Mm-hmm.
Yeah. And I see we have questions from the audience, but I think that's the whole point of therapy. That your therapist is the person in your corner. They're the person that you can vent to, you can cry in front of, you don't have to be embarrassed or ashamed. That's the beauty of therapy. And so at Ovom Care, we hope that if you need therapy, and even not sure if you think you need therapy, that you would speak with our partners at Sysi, because this is what the point is that you don't have to go through it alone. You do have someone helping you and with you every step of the way throughout the journey, because it is a journey and everyone's journey is different and everyone's needs are different. And that's what therapy can help you do. So we have some questions, and I'm going to ask the question and then I'll maybe designate someone to answer it. Do you have any advice on how to communicate my fertility struggles with my family and friends? So Renato, you just touched on this, but I'll go back to Blanca and ask you, do you have an answer for this?
Yeah, I mean, I think kind of goes back to, just because they're your family doesn't mean that, you have to share everything. Your relationship dynamics are different. You have different family members. So it's about put the spotlight on you, not on them and what they want to know and what makes sense for them and how they're going to feel. Put the spotlight on you. What is it that you need? What is it that you want to share? What's going to make you feel comfortable? And then take it from there, right? If what's going to make you feel connected is to speak to your sister about it, then do that, right? If you don't want to speak to your sister about it because you feel she's going to judge, or she's going to, give her opinion, and you don't want to hear that right now, then don't. It goes back to put the spotlight on you and what it is that you need.
Miriam, anything on your side from that?
I think that probably echoes what Blanca and Renato was saying, but I think this is your time to be choosy. You will have those friends that maybe give you unsolicited advice and always want to fix things. And there's always a time and a place for those friends, but maybe you don't feel like seeing them on a particular day, and that's okay. Maybe there's a friend who listens and is a shoulder to cry on, and maybe it's a time to really get to know who those friends are and which ones you need at certain times in your life, and you get to pick and choose.
Thank you so much. We have another question. Again, it's with talking, and people giving advice. How do I deal with people who don't understand what I'm going through and they say hurtful things, even if they mean well? I can think of certain things like, oh, just relax. You just need to relax, as if relaxing was all that helped you to get pregnant. So, how do you, would you say?
Just take a vacation.
Just take a vacation. Well, you can do that at Ovom Portugal. You can take a vacation. We can help you get pregnant, but we need to do a little bit more sometimes. So how do you help patients walk through this? Maybe Renato, maybe you can talk about what would you advise your patient to say?
It's exactly what I said before. There are it's intimacy. Intimacy, it's you looking inside yourself. It's into me see. It's you looking to yourself. So you need to be intimate with the person that you think that you allow to be intimate, not to everyone. So even if people mean well, and most of the times they actually do mean well. So I'm not seeing anyone being specifically harmful or just out of some personal vendetta. Sometimes it happens as well, especially in the workplace. You have people that are frenemies, so it's your colleagues, but they actually don't like you. And as soon as they see a soft spot, they just go there. And sometimes they try to look like they are saying very nice things, which they aren't. But you need to set the boundaries. It's about boundaries. Say know your no's and know your yes.
Miriam, what can you say? Like sometimes it happens and it really does take people by surprise. What are some things that they can say to sort of, shelter themselves from the mean things that are being said?
Yeah, it did really resonate with me there. I think Renato's right that people aren't trying to hurt your feelings necessarily. But I think a lot of us are really solution orientated, aren't we? And so there's a problem and they're just immediately trying to give you answers and give you like fix it. People are always telling me incredible stories about how other people got pregnant by eating mushrooms, or did you know that my auntie's sister's cousin went to India and took this pill? And it was like, are you giving me this advice? And it would be incredibly hurtful, and it felt really tone deaf. And I learned that I was never very good at asking for help, and I was never good at putting boundaries down and asking for what I really needed. And I realized, if I wasn't going to say it, they were never going to know. And so it was a real learning for me, and I'm not saying it's easy, but I think there is something in communicating, saying, I don't really need solutions right now. I would like to have a coffee with you and be able to cry about this or to complain. That's what I need, and to make it really clear. And it's hard. I would be saying it, my cheeks would be red, I'd be embarrassed, but I said it anyway. And the people that did care really did hear that. I think there is also something about, and I think Blanca, maybe you touched upon it, not feeling like you have to do this work spontaneously. If you know that there are people in your life who have a tendency to be abrupt or ask hurtful questions, maybe you're scripting that in advance, and maybe you have something prepared for them, just very things that maybe move it away. You don't have to be having a confrontation, but maybe that are like, oh, I don't really have time to talk about this right now. Actually, when you say this, it's hurtful. Maybe but it would be helpful if you brought me dinner. Crazy example, but giving them other things that they can do, which maybe fulfills that need for them to be helpful, is maybe an idea. But you don't have to know immediately what it is. Maybe it's for you to have a think about that and think about the most comfortable way for you to communicate it. It might even be in an email or a WhatsApp. It doesn't even have to be face to face.
I love that. The next question that we have is, I'm starting treatment soon and I'm worried about how overwhelming it can be. How can I prepare myself emotionally? Blanca?
I think it comes back to start with your relationship with yourself, right? I cannot emphasize enough how much self-talk matters. If you think about like, how are you speaking to yourself? Are you telling yourself, maybe this is going to be difficult, but I can do this? Are you, being compassionate? Are you allowing yourself to feel different emotions? Are you, looking after yourself, not only emotionally, but also physically? And I think that's, a really important thing to keep in mind is to look after yourself. If you want to look after your emotional well-being, you've got to do it from a holistic lens. The body and the mind are so interconnected. One does not exist without the other. So while it's very important to look after, your mental health needs, let's say set boundaries, seek care, look after yourself, prioritize stuff, all of these things that we've been talking about, but equally also prioritize your physical health. So make sure that you're getting enough sleep, that you're eating nourishing meals, that you're, moving your body, because the two of them come hand in hand. And, often people focus on one or the other, but it's so important to do both and really approach your emotional well-being from a holistic lens.
Thank you for that. We have another question, and I'm going to give this over to Miriam. I'm worried about managing work while going through treatments. How can I keep my stress levels down?
I think that's a really good question, and that so many of us people are having to manage work and fertility, and it can feel all-consuming. I think it does speak to honoring what you need. You will be working and you will also be going through fertility treatment, and you're going to need to take time for yourself. And so also remembering the other parts of you. This can feel like quite an all-consuming time, but there are so many facets of you. And so really leaning into the things that you love and enjoy is even more important than ever. Really make time for that. Make time to and spend a bit of time with your partner or your friends, doing exercises that you enjoy, really nurturing the other things that you enjoy as well, so that it feels restful, and so you feel much more able and energized to focus on this journey ahead of you.
Thank you. And you mentioned, take time to spend with your partner. And the next question is actually, my partner and I are handling this process so differently. How can we support each other better? Blanca?
So the first thing I would say is communication is key. It's so important to create a safe space where you can both voice your feelings, your emotions, your fears, your needs without fear of judgment. We often make assumptions about how people should feel based on how we feel. And it's so important to not do that with your partner, to really allow themselves to process it differently. I'd also say prioritize spending quality time together, taking the spotlight a little bit off the fertility topic, right? As Miriam said, it can be so all-consuming. It can also get quite obsessive, and I think it's important to really enjoy quality time together, whether it's starting a new hobby together, going on a date, having a nice quiet evening, watching a movie at home, whatever it may be. But to really allow yourself to be able to connect, right? To connect and continue, strengthening your bond, and not have the fertility topic completely dominate, every conversation, every date, every moment, because that can get very frustrating for both parties. And then obviously, the last thing I would say is, couples therapy is always a great option. It can help you navigate your challenges, improve your communication, understand your dynamic better, understand, your story, your needs, your fears, whatever it may be that's coming up and affecting the dynamic. It can really help you to really work on that.
Thank you so much. And if you have any other questions, make sure you put them in the chat. I have a question, actually, from my perspective. I've heard this before for people who are going through a fertility journey alone. They're just planning on egg freezing. They may not be infertile, but there's also a grieving process, that there's an admission that they're single and that they don't have a partner. What would you recommend to those who are egg freezing, who are hesitating to egg freeze, because it does make it real that they are unpartnered?
That's a really, really great question. The first thing I would say would be to change the narrative. Egg freezing isn't about what you're admitting. It's not about your relationship status. It's about making a choice that feels right to you. It's a form of looking after yourself and taking control of your future. So really putting the spotlight on what it is that you need over what other people would say or what other people are doing or how you think things, what you once thought things should look like, right? So really prioritize on yourself in the present moment and what you need. The other thing I'd say is, if you're struggling with being single, to really confront those feelings, ask yourself, what is it I'm feeling? Why do I feel that way? What's coming up within me? Often we kind of avoid uncomfortable topics that come up, and then it only gives it more power. And what you don't want is a situation where your insecurities or your avoidance of really facing how it is you're feeling dictates your decisions for you. So I would say to really, really take time to process, to think. So it's not that insecurity that's choosing, it's you making a good choice for yourself and for your future. And then I think the last thing would be talk about it. I think we really need to normalize speaking about all kinds of fertility related issues and challenges and all different, for all kinds of different people. I think we really need to normalize this conversation and help break stigma. So I would say speak about it, share your experiences, and support each other.
Thank you so much for saying that. Don't let the insecurity dictate to you. Make an active decision. I think that's a really great nugget for all instances in life. And Blanca, you've said this a couple times, so just to maybe clarify how you speak to yourself. And I heard this once in the support group that I was in. I feel like an old horse that needs to be shot out at pasture. That is the self-talk that is extremely painful and extremely hurtful to one's inner self, to your psyche. Can you give examples of ways that we can lift ourselves up when we're talking to each other or to ourselves?
Well, I think it depends. It depends so much on the individual, right? And the insecurities of each person. I would say, like, for example, if you're telling yourself, oh, I'm so old, be like, to really stop and be like, you know, I often think of your relationship with yourself sometimes it's very difficult for people to really process it because it's within you. So what I often say is think about it as a relationship with someone else, right? If you have a partner, if you have a friend or a family member, and you're telling them, oh, like you said, you're so old, or your clock is ticking, or oh, I can't believe you're in this situation, or gosh, you should not be upset right now. Like if you were speaking to someone about that, imagine how that would make the other person feel. Imagine what that relationship would be like. And so if you wouldn't speak to someone like that, don't speak that way to yourself. I think that's a good kind of filter would be only speak to yourself the way you would speak to someone that you care about, the way that you would speak to someone that you love, and the way that you would speak to someone that you want to look after, and to keep checking in with yourself.
Great advice. And we have another question from the audience. If I'm feeling emotionally drained during treatments, should I let my doctor know? And how can they help me manage that? Renato, sometimes I'm sure you've seen the tension in the room or heard the tension in the room, but there's a step before that. When do you think patients should disclose to their doctors?
Yeah, actually, I saw a couple divorce in front of me, so that was a very awkward situation because I was what I'm supposed to do, like help with someone, because they were fighting in front of me, and then it led to a divorce. So they actually separated, especially because of that situation where, oh, it's your sperm, it's my cyst, it's this, it's your eggs, it's this. So people start like blaming each other. They started on that, and that it's like a snowball. It just grew and grew and grew, and by the time of it, they were just separate ways. The advice is rather tell it sooner than later, because we're not Harry Potter. We don't guess. If you are smiling in front of us, but inside you're feeling deflated, you're feeling down, you're feeling bad, we are not able to see it. Even though I tried to, I imagine when I was still in medical school, one of the pathways that I was going to follow was psychiatry. I'm not trained in psychology and in psychiatric and in mental issues, so I'm not able to pick up those small things that perhaps are there. But and it's only 45, 15, half an hour talk that we have. So, and we have to cover so much. We have to go through diagnostics, plans, treatments, explain treatments, give you recipes. So there's lots of medical jargon that I try to make it as easy as possible. And it's done in such a little time that sometimes if you don't say anything, we are not able to pick it up. What I think it's very wise is just to have like a screening, like everyone that goes through this process, even if you're not struggling, if you think that, oh, I'm in my best mental health possible, please talk to someone. Just make that initial conversation with someone from the psychological part of it. Just say to them, well, just make an appointment, talk to them, so that if at any time you feel that you're struggling, you have something to lean on, someone to talk to. That's the best advice that I can give.
Right. Absolutely. Because we don't know how we're going to respond to the journey. The journey has lots of twists and turns, ups and downs, and it's always good to have someone who's just taking care of your mental health, because fertility is a disease. Infertility is a disease, and we are treating the physical as fertility specialists, but we also need to treat the emotional, the mental health component of it. And that's really why we brought you this seminar today, to at least talk about it. You don't have to, feel that you need therapy, but even just going to speak to a therapist really lightens your load and gives you the tools and the safe space that we've talked about having to alleviate some of that pressure, that stigma, that shame. So it
And the-
has been.
and just coming back to a little bit, and the main goal throughout the journey, it's not getting you pregnant. It's not getting a positive pregnancy test. What we want, everyone that works in this field, is to get you a healthy baby, but also a healthy parent. So
Yeah.
we do not want to give you a baby, but leave you completely out of
Got
the
it.
world,
Right.
just on the journey getting there. So it has to have this balance of getting you home safe with your baby, with your partner, or alone, whatever you decide to, but to have a healthy parenthood. That's the main goal.
Absolutely. So any last advice before we close the session, Blanca, Miriam?
I think something I would add is, seeking help is a sign of strength, not a sign of weakness. Often people feel, if I was to get help, I'm admitting this to myself or to others. And if you're struggling, then you're struggling whether, no matter what, so it's like you might as well look after yourself. It's empowering. It's an act of self-love. It's an act of self-care. It improves your relationship with yourself and your relationship with others. It improves, the way that you navigate the journey. So that would really be my closing statement, to really view it as a strength.
It is a strength and it keeps you strong, and it's actually something that this is transformative, actually. And as much as we have talked about grief and stigma and stress, actually this is a journey of joy, isn't it? I think Renato touched upon that beautifully. We're working towards making a family here, or supporting you to do that, and that's a journey that's full of hope, as well as it has its ups and downs. So this is a positive thing, and I really want people to take that away with them as well, not to be worried and feeling too dismal about it from the outset. You are allowed also to feel hopeful and joyful, and for this to be a great journey.
Absolutely. Because no matter what, we can help you to become a parent. There are many different ways to become a parent, not just IVF. And being emotionally in a good place, as Renato said, is really important to that journey. And that even if the IVF doesn't work out, even if the transfer doesn't work out, you can still have a pathway to parenthood. So thank you so much to the panel for coming out tonight virtually. And for those of you watching at home, just to let you know, if you are a Sysi customer, you already are entitled to 10% off any type of treatment that you would do at Ovum. And if you are an Ovum patient, you are entitled to a 20-minute free consultation with our colleagues at Sysi, and you have a 20% discount off the very first 3 sessions with the code OVUM20. Because we do believe that mental health is as important as your physical health at Ovom Care, as well as at Sysi. So this has been a true joy and pleasure. And we have one more present for those who stayed along. There is something called seasonal affective disorder. And some of you might be suffering from it right about now because it's usually in the dark winter months. So you might want to consider that we are providing free flights to Portugal if you decide to have care with Ovum, in addition to the discounts that I mentioned with our partner, Sysi. So thank you all again for joining us this evening, and have a wonderful start to your new year and a wonderful rest of the week. Thank you so much, everyone.
Thank you.
Thank you.